Okay, hi everybody. Let's get started. There may be a few more people who might be joining slowly but surely. So, thank you very much, everybody, for joining today's Cancer Survivorship meeting. I'm very excited to have all of you here. And before we get started, some housekeeping notes. This call is being recorded. If you are experiencing technical difficulty, please use the chat for assistance or the help options within Zoom. All lines have been muted. Please consider turning off your video camera during the meeting just to help with bandwidth. During questions at the end, you are more than welcome to put your camera on if you feel comfortable. And then given the volume of virtual meetings and that our staff is all working remotely in separate locations, we apologize in advance for any network connectivity issues, and we'll do our best to solve problems as they occur. So we appreciate your flexibility. And then thank you to everybody who has been filling out the poll and commenting in the chat. And so my name is Alexandria Callweatherer, and I'm an outreach specialist with the Wisconsin Cancer Collaborative. And so from the chat and from the poll, I'm seeing that for survivorship services, what we would want to add the most, generally speaking, are mental health, fertility services, and physical activity. So thank you for participating in that. And so let's take a look at what we should expect today. We are first looking at a short overview of the project and survey results. Then in lieu of traditional networking time, we're going to be hearing from all of you guys, the survey sites themselves, as you give a 5-minute flash talk about your work. We will have questions at the end of presentations in order to give everybody a chance to present. And then we will go over questions and wrap up miscellaneous things. And then as a note, we don't have any scheduled breaks, so please feel free to step away if you need to run to the restroom, get a snack, or anything like that. So today I hope to share key survey findings, share opportunities for improvement, facilitate connections between all of our individual work, share resources, and then my future goal is to establish a community of practice for those of you who want to participate to improve survivorship programs in the state. Before I get started though, I wanted to provide some background on where I'm from. So the Wisconsin Cancer Collaborative is Wisconsin's statewide comprehensive cancer coalition comprised of 140 organizations working together to reduce the burden of cancer for everyone in Wisconsin. We connect our members with the tools, support, and knowledge they need to create healthier communities. And I know many of you are already members, so thank you for that. But if you're not yet a member of the collaborative, we would love for you to join. Membership is free, and you can visit wicancer.org for more information. And then our work is guided by the Wisconsin Cancer Plan, which acts as a blueprint for action, which was just released in August. The Wisconsin Cancer Plan combines best practices, reliable data, and concrete action steps for health system leaders, public health advocates, policymakers, researchers, and all other Wisconsinites engaged in cancer work. Our mission is to engage diverse partners to develop, promote, and implement a statewide approach to cancer control. And then in our plan, we address the cancer care continuum from risk reduction to end of life with two very important bookends of health equity and data that encompass all topics. If you would like to learn more or get involved with our work, I invite you to attend the upcoming 2020 virtual Wisconsin Cancer Summit on October 28th and 29th, and registration is still open for this. So let's get started, and I'm going to first start with a project overview. So we're all representing multiple different roles and perspectives, so I think it's good to start with a definition. And this definition comes from the National Cancer Institute. And I realize it's a lot of text, but it's very comprehensive. And so cancer survivorship is really focusing on the health and well-being of a person with cancer from the time of diagnosis until the end of life. As we know, survivors have unique needs, and this includes physical, mental, emotional, social, and financial effects of cancer that begin at diagnosis and continue through treatment and beyond. And it's important to note that family members, friends, and caregivers are also considered part of the survivorship experience. As the number of cancer survivors grow, physicians and healthcare teams need to establish approaches to addressing these needs. Also, we know that survivorship is being addressed across the state, but where are we at? What's the benchmark? Therefore, we reached out to several cancer care locations in the state, trying to ensure a representative sample. Some of these sites are still in the early stages of building survivorship work, and some are well established. Some are rural, some are urban, some are the main locations within a system, and some are the satellite locations. And we surveyed multiple sites in Wisconsin to determine the following questions. What survivorship care practices are currently taking place? What does the typical survivorship care program include? Is there even a typical program? What gaps exist for Wisconsinites? And where can we maybe improve? And to help create the survey and inform our process, we created a survivorship advisory panel. And I'm not going to read through the list of names, but I wanted to include them here and just acknowledge that the work that they provided and the feedback they provided throughout this process. And you might recognize a few names from your health system. And thank you to any panel members who are here today and who've helped with recruitment of sites. And then I wanted to briefly share with you our plans for these results, as there's quite a bit to it. However, the relevant pieces for today are determining themes, creating a future community of practice with participating survivorship programs in the state, working towards quality improvement in our survivorship work. And then please also feel free to share any important survivorship work you're doing or any successes. We love to highlight these with our members, so we always look forward to hearing stories from you. And then after this meeting, you will be invited to work as a cohort of peers to identify opportunities you would like to work on to address gaps at your site. And so Wisconsin Cancer Collaborative staff will provide technical assistance, such as making connections to partners, experts, and sharing tools for success. So things like work plans and things like that. And then the time commitment for this community of practice really depends on the strategies you choose to implement and will likely vary depending what time you have and can realistically put forward. And then I'm just including this as a FYI. I would like feedback on this timeline after the meeting, once you've had a chance to think about this on what you think is feasible. And we realize and understand that each participating site and health system will require a great deal of flexibility, just given the current demands on the public health and healthcare infrastructure in our state. And so I provide that tentative timeline just as guidance for now, knowing that it'll probably change. And I know that we can have the best chance, and plans and things are constantly changing. So I'm definitely open to feedback in that regard, but wanted to just kind of give you a heads up on what we're thinking for next steps. So let's get into the survey results. And so please bear with me as I'm going to be throwing a lot of data at you. And we did ask for a lot of data and we're limited in the time to report out today. So we'll certainly be sharing back out the findings in more detail. And as a reminder, the slides will be available for your review afterwards, and individual snapshots, especially if you want a more thorough review, because I know this is going to be a lot of information. So first off, I want to thank all the survey sites that have participated. I know that a lot of us have been struggling with competing priorities in both our personal and professional lives. And despite all of this, we've had 40 sites represented in this survey, which I'm really impressed by. And not to mention that there were other sites that needed to drop out that were initially interested. And I'm just so thankful for the hard work of this group, and I want to acknowledge that. Now, some of the locations might not be included in this analysis today if they were submitted after the deadline. However, just so you're aware, we are allowing data collection to extend till the end of October, as we recognize that many health systems are handling COVID-19 in different ways, different caseloads, et cetera. And so I'm hoping to create some sort of report findings to share with you all in the coming months, year. And this will include the updated data. So good news, all 72 counties in Wisconsin are served by the survey sites, albeit some people may still have to travel quite far for those services. And then survey sites are represented here with the dots, and they do cluster in the Milwaukee metro area and the Appleton, Oshkosh, Green Bay area. And we can see gaps, especially in the northern part of the state and the southwestern. It's important to note that there are some cancer care locations in these areas that may not have been able to participate, but also these services are limited and many Wisconsinites do travel either in-state or out of state for services. A majority of the survey sites serve primarily adult and geriatric populations, and often adolescent or young adults can also receive services at these locations. And then one part I was really interested in is because there's so many different ways to approach survivorship care programming in Wisconsin is who has oversight. And so what we found is 14 sites, so about 36% have a designated survivorship program director. 7 sites have a cancer council. 7 sites have survivorship coordinators. And then there were various other roles that are listed here who oversee survivorship services at other sites. Additionally, one strength is over 80% of sites have these services available to survivors. And so I've listed these here. So one thing I was excited about seeing was the clinical trials, genetic counseling, individual education, financial counseling. And many services are also available within the health system at other locations that patients may have access to. And then the 10 most frequently not integrated services or roles at cancer centers in Wisconsin are in this slide. And so the top 3 not integrated were community health workers, reproductive endocrinologists or fertility specialists, and psychiatrists at a majority of our survey sites. And then less than half of our survey sites offered these services at their facility. So as you can see, there's a lot of things with sexual health services, psychiatry, primary care transition services. So a lot of things that are kind of related to these type of topics on this slide. And then we also wanted to look at services that you all are offering to caregivers. And so we're doing a really good job of providing survivorship care plans, discussing these, offering financial services, providing educational material. And then psychology services is included, and that was at 71.8% of sites. And then actually education on caregiving was the lowest on the list at only 61.5%. So I'm going to have a few graphs that are maybe a little hard to look at. So I've included a key takeaway slide after this in case that helps you in the future. And so we were really interested in discussion of late and long-term side effects. And then the need for regular follow-up and screening post-treatment is most often a standard of care at most of the survey sites. And then receipt of a written treatment summary was frequently a standard of care as well. And then discussing need for emotional and social support was most often a standard of care. However, referral to a specialist for mental or behavioral health concerns was not. And this service in particular received the largest spread of responses. And maybe this reflects that all survivors are not meeting their criteria to be referred to a specialist. However, this also perhaps highlights an area for improvement, as we know mental health is an important part of the survivorship experience. For example, as many of 3 out of every 4 cancer survivors experiences symptoms of psychological distress or cognitive concerns, which can negatively affect their overall well-being and health outcomes. And then, so distress screening is recommended for cancer patients in all clinical settings. And I did see many of you mention those NCNN distress guidelines in the survey. However, other studies are also suggesting that 1/3 or fewer cancer survivors have talked to their doctor about their psychosocial needs and concerns. And even fewer survivors receive treatment for distress. So I just include this as maybe an area to strengthen and just to be aware of. And then keeping all applicable clinicians up to date with survivorship care, as well as the ability of clinicians to meet any of the patient's survivorship needs resulting from cancer treatment, were least often standards of care. Providing referrals to specialists for follow-up care or concerns related to late effects of treatment were commonly provided only if patients met certain criteria, and that makes sense. And then same goes for cancer clinicians providing post-treatment survivorship care. And again, just including these takeaways, so if you're looking at these slides later, you kind of have an interpretation of the graph. And then access to physical activity, facilities, dietary nutritional science services, or risk reduction services were not a unanimous standard of care, and these were offered standardly by less than 50% of sites. These were most often provided upon request or if risk stratification criteria was met. And then exercise and physical activity services are most often referred outside of the health system entirely. And that's an important topic too, because research shows that survivors who keep a healthy weight and stay physically active can have better response to treatment and survival outcomes, better mental and physical quality of life, lower risk of subsequent cancers, and then lower risk of developing a comorbid disease or illness such as diabetes or heart disease. And then maintaining a point of access for survivor concerns and clinicians working in teams to address post-treatment needs was most often rated as a standard of care. And it appears that sites are reporting that survivors are receiving help with insurance and financial questions when requested. And then let's talk a little bit about survivorship care plans. And a majority of you are using an electronic health record built template such as Epic, specific to your health system. 3 are using Journey Forward templates, and 1 site is using the ASCO survivorship care plan. And then survivorship care plans were almost unanimously given to only some patients. Usually, you guys indicated these are given to curative intent patients of many different treatment types. However, some provide survivorship care plans when specifically requested by patient, no matter the circumstances. And then when given, survivorship care plans were most frequently given to patients, but 79.5% of survivorship care plans, so at survey sites, they were saying they were giving these to primary care providers as well. And then 20.5% of the survey sites indicated it was also given to other medical specialists. And then we asked the survey sites, which cancer types are you routinely providing survivorship care plans for? And so here's a breakdown of that information so far. And of these, breast and prostate cancer patients are most likely to be receiving survivorship care plans. And then hematological and sarcoma cancer patients are receiving plans the least based on our current data. And then in regards to late and long-term effect discussions, so many late long-term effects such as heart, lung, lymphedema, thyroid, osteoporosis, dental problems, and fertility issues were discussed with all patients to which such issues were most likely to be at risk for. And then the percentage of sites indicated these effects most commonly discussed with all or almost all patients include increased risk of subsequent cancers, digestive health problems, nerve damage, and then sexual function. And then I just want to mention, so sexual function is quite varied on the responses here. And so sexual functioning was also a topic in the rarely or never discussed category. And that may be because of cancer type or circumstances, but that was just interesting to me that that was quite across the board. And you can see this here. And then emotional distress and fatigue were discussed most frequently with all or almost all patients. And same goes for mood changes and health practice changes. And then cognitive changes and insomnia were most frequently discussed only with patients most likely to be at risk for these effects. And then thank you to all of you for providing lots of great organizations and community partners that you're referring patients to. And then the top community partner referrals are ABCD after breast cancer diagnosis, the American Cancer Society, the Live Strong program at the YMCA, as well as various other home health services. And then I just wanted to include this because this was some sort of withstanding questions and ideas that the group provided as additional feedback. And I thought it was really interesting to share. And so a lot of questions about how do we best provide visits and services virtually? How do we approach community resources such as the Live Strong program in the context of the COVID-19 pandemic? So especially as gyms are closed or group size limited, concerns about your own individual health, what does this look like? And then just some other things that people are bringing up, integrating behavioral health into cancer centers, looking to have a weekly survivorship clinic, access to oncocardiology, and then developing a more formal NP or PA-led clinic model. And then this isn't directly related to our survey, but I just wanted to bring this up with everybody. So our organization has compiled various survivorship resources aimed at helping healthcare providers and community partners looking to add or further incorporate cancer survivorship into their work. We're also always welcome to updates for this, or if you have great resources, please send our way. And this is currently on our website. And then George Washington University offers a free e-learning series where you can earn continuing education credits if you wish. I know this survivorship training is aimed mainly for primary care providers, but there's still some modules that you may find helpful and may enhance your knowledge of survivors' needs. And then feel free to share with primary care colleagues, staff you know of as well, because this could be a great resource for them. And then I find it kind of funny, I'm bringing up another survey for you all, but so this is from a patient perspective. We have two current surveys we'd like to mention that you may want to consider providing to your patients. And firstly, the GW Cancer Center and the Commission on Cancer are conducting a survey to better understand cancer survivor experiences during the pandemic. And then also, secondly, there's a national survey specifically for LGBTQI plus cancer survivors that is currently ongoing. And we would love your help in getting Wisconsin represented in this data so we can better identify and address the needs of our LGBTQI plus populations as well. Okay. And then so that was kind of what I had overall for just a general sense of the survey responses. We're going to be working on individualized feedback for the organizations shortly, and also working on compiling a report once every survey site has been included. And then I just see in the chat that Dr. Loconte brought up insurance coverage for psychological support is a barrier too. So thank you very much for bringing that up. And I very much recognize that. So that's good to know. And then in the interest of time, I think we should proceed with our flash talks. And then I'm happy to answer. We can do questions at the end for the flash talk sites and also about the survey, if that's okay with everybody. And so I'm really excited to hear more about your programs and approaches regarding survivorship. And I think in healthcare, we can sometimes be a bit siloed by our systems or our geographic location. So I'm hoping this will be a good opportunity to learn from one another. And then I've also asked you all to provide your contact info in these slides so that if somebody in the group is interested in working on something similar or wants to find out more about what you did, they have a good contact. And I know we don't get to do the traditional networking like I hoped we would be able to. I think there's a lot of value in that. So thank you for bearing with the situation and just kind of making the best of it. And then I'm going to ask you when it's your turn, please unmute yourself. And then we're going to save questions again till the end so we can get through all the speakers because I'm sure there's going to be some great questions. And I know it's also very hard to summarize all your work in 5 minutes. So thank you for doing this. And so we're going to start with Eileen and Taylor from Gunderson if they are able to. And then I'll just ask you to say next slide and I can proceed that for you.
All right. So we have 3 people in here. It's Taylor, Eileen, and Amy. And we are from Gunderson Health System in La Crosse. You can go to the next. Yep, thank you.
So this is Eileen Williams, PA in oncology, an overview of our program. So initially we started as breast cancer focused for our survivorship visits. And then we subsequently grown to other primary disease sites such as head and neck, colorectal, lung, GYN, and prostate. And then we're hoping in the future to include all primary cancer disease sites for our survivorship program. Our survivorship program has a survivorship director who's a MD. And then we also have our survivorship program coordinator who is Taylor. Our visits are conducted by advanced practice providers that include PAs and an NP. We give the cancer treatment summary survivorship care plan at each survivorship visit, and that is reviewed with patient. It's also a live document that lives in the electronic medical record, which for us is EPIC. It is guided after the ASCO template. And we had 2 survivorship clinical trials so far, one as the effectiveness of our survivorship program. And that was published in the Journal of Journal of Oncology Practice. We also have a separate trial that is in the process of publication looking at 2 survivorship treatment summary templates, one from the NCCN guidelines versus ASCO. Next slide. We feel that our strengths of the programs are patient education, including going through line by line with our treatment summary. We also provide patients education about nutrition, a handout developed by our dietitians, as well as education about exercise, sexual health, there is a whole patient education folder that's given to each patient, and it's tailored for their disease site. For instance, if we have a breast patient, again, sexual health is included with that patient education, whereas if I have a head and neck survivor, there might be more information about lymphedema, dental issues, swallowing, dry mouth, things like that. Referrals are also a big thing that comes out of our survivorship clinic. So we have referrals for lymphedema, for nutrition. There's comprehensive weight management consult that we can do in-house, as well as exercise referrals with the Live Strong program. And then areas of improvement, I see, especially in this current context of COVID, more virtual opportunities. So we're trying to do more virtual visits. Those are done through Skype for Business currently. And we're hoping to do more of those so that we can keep patients safe rather than bringing them into the clinic for what is mainly a discussion visit, unless they would need an exam with that. Also hoping with the virtual opportunities that we can include behavioral health therapy maybe in the future, support groups that could be virtual to bring in that piece. Next slide.
So this is just all of our contact info. So Eileen is our survivorship provider. My name is Taylor, I'm the coordinator, and then Amy's here and she's our program manager. Thank you.
Thank you very much. That was great, and great job summarizing just a complex program, and great to hear. So thank you. Okay, and then we are going to head to Jamie from Aurora.
Hello.
Jamie, are you with us? Thank you.
Yeah, can you hear me?
Yep, I can hear you well.
Okay, well, this first slide is just an overview of Aurora Cancer Care. We provide cancer services in 10 counties, 16 hospitals, and 22 clinics throughout Wisconsin and Northern Illinois. We have 19 multidisciplinary disease-specific cancer clinics for 10 diagnoses. We have a very large clinical trial program that does include some survivorship trials. And we also have one of the largest groups of medical oncologists in the United States. So that's just a really brief overview of who we are. Next slide. So in terms of care planning, we have tried to have a system-wide approach. We have 15 disease-specific survivorship care plans that are built into our EPIC. I think the care plans are similar looking to what other EPIC organizations have. There's some auto-population functionality. The care plans allow for multiple disciplines, so surgery, cancer nurse navigators, et cetera, to enter data into the EMR. And our model of survivorship is an embedded consultation with an advanced practice provider or cancer nurse navigator, doing a survivorship visit with a patient at the end of their first line treatment, typically 3 to 6 months post-treatment. We do have a clarity report for quarterly data tracking, and we have, last year we had over 1,200 dedicated survivorship visits. So we know we need to be doing more. We'd like to be doing more. And so we're constantly working on how our survivorship program can work for everybody, given that we don't have like one center where we're doing survivorship. We're trying to do this diffusely throughout the entire program. We do have a subcommittee that meets quarterly that kind of reviews what we're doing and talks about gaps in care and workflow. So that's a little bit of an overview. Next slide. Yes, we do have quite a bit of support and a lot of resources. We do provide education and screening for our cancer survivors and revisit that topic frequently. We do have several informational survivorship series for survivors. Interestingly, in the days of COVID now, we're expanding the outreach of those because some of those series were really only available in certain locations to a group of survivors. And now that we're doing things online, we're actually able to kind of open that up a little bit to target some of our other areas that didn't have the series available locally. We have an extensive and really well developed cancer rehab program, an exercise program. We have dietary and nutrition support at all of our locations, and in some of our clinics, we're doing a multidisciplinary survivorship visit where the patient not only meets with the advanced practice provider, but also meets with a dietitian. And in some locations too, we have an embedded psychosocial counselor who sometimes meets with the patient as well. So we try to provide that real-time psychological support. We do have an evolving cardio-oncology program and are focusing some attention on that these days as well to try to better streamline how survivors get connected with that. Financial and social services navigation, we have that. And we also have a very active integrative medicine program and are finding that our cancer survivors are very interested in making those connections too. So we have that embedded in a number of our clinics and try to integrate that into our survivorship visits as well. Next. I think one of the highlights of our survivorship program is Team Phoenix, which was developed by Dr. Judy Tijo and Leslie Waltke, who's our the head of cancer rehab. They developed this program a number of years ago. I think it was like 2010. And it actually is a 14-week sprint distance triathlon training program. It started out with just targeting breast cancer survivors, but now we are looping in women, all women cancer survivors of any type, any age, all fitness levels. We've had some people who had a hard time walking at the beginning of this and actually were able to complete the program. So training begins in mid-April and goes through the end of July. Group training is twice a week with prescribed training plans for training at home the other 3 days a week. Post-season training is offered year-round for our alumni. Team Phoenix is subsidized by donor and community support, and to date, 310 survivors have crossed the triathlon finish line. This summer, 150 survivors joined a virtual program that was necessitated by COVID, including 40 new athletes. So this is something that we are offering primarily right now in the Milwaukee metro area, although we have had offered it some summers in our South Market, Burlington, Kenosha, Racine, and there is a desire to expand this to some of our other markets as well. But this has received national attention, and there's a lot of research that has gone on with these patients as well. And so we're just very proud of this program, part of our program. And then next slide. So our current focus for improvement right now is we feel that, especially in these times of COVID, that we have a lot of information available on our website, but we want to make it more easily accessible for survivors to obtain that information. For us, our website and keeping it functional and appealing to our patients has been a real challenge. Sometimes when you work with marketing folks, they have a different idea of how things should look. And so we really want to improve our website, and that's our main focus with our subcommittee right now. So that's our survivorship program in a nutshell, and my contact information is included.
Thank you so much. That was great information.
Thank you.
Okay, and then we're going to hear from Sibeli from Carbone Cancer Center.
Hello, everyone. Can you hear me well?
Yes, I can hear you great.
So my name is Sibeli. I am a researcher from Carbone Cancer Center Survivorship Research Program, and thank you very much for the opportunity to introduce our program today. So our program is a research program and was created in February 2020. So the idea of having more central resources to support researchers is happening for more than 2 years ago. Uh, and the program was formalized at the end of February 2020. So the program focused on the trajectory of cancer care and specifically issues related to the population health management of cancer survivors that may occur during and after primary treatment, as well as with the transition of care into post-treatment survivorship care, and also touches the effective transition to palliative and end-of-life care. So mostly our program encourages, facilitates, and conducts research to address the needs of cancer survivors and their families, uh, helping to establish good practice for survivorship care. Next, please. One strength of our program is to be a truly interdisciplinary, collaborative, and active research team. Uh, we had more than 20 peer-reviewed publications this year, and these are just a few examples of the areas where our faculty team members are publishing and working and researching on. Next, please. Another strength is some of our faculty team members work with electronic health records research. So this research is focused on leveraging health information technology to improve communication and care coordination for patients with cancer. Next, please. So an area for improvement would be the organization of a more clinical service. We already have survivorship clinical support and survivorship clinical care happening through the institution, but we're looking to make it more cohesive over the multiple disease teams. We're also supporting Dr. Amanda Parks in the development of an AYA survivorship program. Next, please. So thank you very much for the opportunity. We are right now more focused on research, and these are our contacts, our email, and our webpage link. Thank you very much for your time.
Thank you so much. Okay. And then do we have Megan Anderson from Marshfield Clinic Health System?
Hi. So I am a program our team is really, with the Commission on Cancer, they're, and you can go to the next slide. There's not very much on my slides as I've been pulled to work in the chemo clinic and work as a navigator right now. So, but our program started in 2016, focusing on breast cancer patients and then adding more diagnosis as each year, trying to follow the Commission on Cancer guidelines, NAPBC, and COPE. I also work as the community outreach, doing educational events. You can go to the next slide. I am the one person that focuses on survivorship, which I guess is a strength and a weakness, as other areas do have a lot of people working together to help with survivorship. But we do focus on giving out survivorship care plans, and then to reach, to be able to give services to the patients. Next slide. Some of the improvements, we do have a lot of services, but it's being able to utilize those of what we have to offer and having the information available to the patients. I think our website could be much better with letting patients know about survivorship care. I think coming from a rural area, we have people coming from such a distance. So trying to figure out how to get services. I know we have people coming from the UP, or coming, I mean, either in from northern Wisconsin. So having resources that they can be able to use in their area. So a lot of improvements, as this is a fairly new program for us. We are working on getting more of a team approach, especially with the changes in the Commission on Cancer Standards, and also looking at the services that we have and how we can better those. So, next slide. And that's just my contact information as well.
Thank you so much, Megan, and thank you so much for joining us. I know everybody has just been emailing me about the different roles they've had to play right now in reassignments. So I just, again, really appreciate everybody's time today. And then next we have Pam Vetter from Aspirus Wasa. Are you with us now?
I am. Can you hear me okay?
Yes, thank you so much.
Okay. Okay, good. Yep, I'm Pam, and here to talk a little bit about the program we have at Aspirus Wasa Hospital. So you can go to the first slide if you'd like. And as you know, we're located in Wasa, but I just wanted to give you a feel for our size too, because we're not obviously as big as Aurora or any of those larger programs. But we do have 5 actually medical oncology providers here in the clinic, 2 in radiation oncology, and then I actually do the survivorship services here. And like Meg mentioned in Marshfield, basically our program is designed after the COC accreditation that we have, as well as the NAPBC accreditation for the breast centers. So you can go to the next slide if you'd like. So what we do for our program is actually we have a team of individuals that is sort of a subcommittee that reports off to Cancer Committee. And I'm actually the coordinator and have just a slew of great team members, including nurses and financial people, pharmacy research, dietitians. We bring in genetics and other specialists as needed. And they oversee basically the survivorship activities that we do provide here. You can go to the next slide. So we broke down our survivorship program actually into 7 different areas is kind of how we look at it. So the treatment summaries and survivorship care plans are one part. We also look at the prevention and screening programs like vaccinations, other screenings, that sort of thing. The various educational programs we offer, referrals, research opportunities for survivors, as well as just different community outreach we can do, and then advocacy on behalf of our survivors. We have one of our team members who's actually an advocate through the American Cancer Society. So she reaches out to legislators, not just here locally, but also in DC and stuff on behalf of the ACS. So you can go to the next slide. That being said, we do have a survivorship clinic within our cancer center as well that I see patients at. And basically it is those curative cancer patients that we see here. But if the doctor feels that there's a patient who would benefit for one reason or another, even if they are metastatic, I do see them as well and go through their survivorship care plan, do various assessments, education, referrals, that type of thing. You can go to the next slide. And I think probably the big strengths are that we do have a lot of support from administration, but also the providers and the staff here who are really great at referring patients or checking in on things and working hard on our team, as well as being part of the research consortium that we are. We are doing a lot more on cancer care delivery research trials, including a few with survivorship care plans specifically. I think I just added my 6th prostate cancer gentleman on a research study yesterday that we just opened. So we're doing well with that. Next slide. And I think kind of like everybody else, one of the big opportunities for improvement we have is just, in this time of COVID, how to kind of rethink how we deliver education, outreach, advocacy, all those types of things, and even get people referred on. And how we do that. So that's kind of our big opportunity. So that's all I have, other than my contact info there if you need anything from me.
Thank you so much. Sorry, I was having a hard time getting unmuted, so I apologize about that. And then, so I believe we have Nicole and Andrea from Theta Care today, if you're able to unmute yourself.
Yep, I think it's just Nicole here today.
Okay,
So,
perfect. Thank you.
alrighty, so you can go to the next slide. So our Wisconsin locations are listed there. Appleton is basically our biggest site. And then we have our, what we call our outreach sites, which would be the Neenah, Oshkosh, Berlin, Wapaka, Shawano, and New London sites. So our regional cancer center is basically our Appleton site, and then those rest of our sites are, and we are we don't really have survivorship clinics, but we do offer survivorship services to our patients. So you can go to the next slide. So our program is, again, like some other people have said, based on the Commission on Cancer, and we're basing it off of obviously the new standards like most everybody else is. And like others have said, we are COC accredited and we are NAPBC accredited. So we are an accredited program. We did just currently implement those new standards. So we have the survivorship program coordinator, who is Andrea, and then I'm co-coordinating that with her. We currently are meeting the needs of cancer patients with curative intent. However, if a provider would like a survivorship care plan given to a metastatic patient or a patient that they want, we do give those care plans to other patients. And then we have decided to focus on 3 services for the upcoming year based on those new standards. And so our focus for the coming year is going to be the delivery of our survivorship care plans, a focus on nutritional services, and then rehabilitation services. And then we're also going to be putting some time and energy into the Time to Heal program. Prior to COVID, we had some APCs that were going to be working on getting us access to that program at our facility and going to be facilitating that program. But with COVID, we're now just working more on doing that virtually. So next slide. So our strengths, we have had over a 90% delivery rate of our breast cancer survivorship care plans to our patients. And then we also do deliver obviously to all cancers, but we just have a strength of, we have quite a high delivery rate to the breast patients just because we're not really quite measuring other cancers. And then we do have a robust team involvement, including active participation by advanced practice clinicians, and then strong navigation team support, which enhances the services that we are providing to our patients. And that includes, other entities like rehab. We have behavioral health on site. We have just a lot of great other services. And then opportunities that we're seeing is we could see a more streamlined follow-up process for patients after completing treatment. So we're working on that. And we are working towards disease-specific survivorship care plans. So currently we are using Epic for our care plans. And it's just a template. So we have to kind of manually put in for each disease what we'd like to see. So we're working on trying to get them to be disease specific. Next slide. And that's just our current contact information for Andrea and I.
Thank you so much. And then we're going to go to Jenny at UW Cancer Center at Pro Healthcare. Jenny, are you with us today? Jenny, I see you on, but I'm unable to unmute you. Are you able to? Or Sarah Kirch, if you're able to help?
I've asked Jenny to unmute, but I am actually unable to unmute her myself as well.
Okay, thank you. Thank you for bearing with us, everybody. So in the meantime, I'm going to go to the next site, but Jenny, I'm more than happy to go back to your presentation. Please feel free to chat either to everyone or privately to Sarah. In the meantime, do we have Deanna and Sherry from Ascension?
Hi, yes, this is Deanna Burling.
Thank you very much.
Hi, thank you. So at Ascension, we have had a survivorship program since 2014. We pretty much started planning for this in probably around 2010 when the IOM report came out, I think a little bit prior to that. But for various reasons, didn't get a formal program together until 2014, where we started to do formal visits and providing the treatment summary and survivorship care plan. So we were early adopters back then, and it was started when we were at Wheaton Franciscan, prior to us merging with Ascension Health. And at that time, it was an NP-led clinic, and it was a hybrid model of a longitudinal and oncology embedded. So it wasn't a separate clinic, it was embedded within the oncology visits with a dedicated visit with a nurse practitioner for survivorship. At that time, when we started out, we were doing just breast patients. And we have since expanded to prostate, head and neck cancers, GYN, and colorectal cancers over the past few years. And this has been with the assistance of our navigators, having expanded our navigation program to multiple different disease sites. We have been able to expand these services to these other diagnoses. And we, since the beginning, we always had a multidisciplinary team available and a structure, including rehab, social work, dietitian, and nursing, and spiritual care if needed. Next slide. So as we reviewed our program in preparation for this, we thought that our strengths were that we do have APPs conducting comprehensive survivorship visits. And these visits are given, the appropriate time, which is approximately 45 minutes to 1 hour for just the NP and RN portion. Within these visits, we also encompass other, healthy behaviors and cancer screening discussions, as well as ensure that patients are receiving everything they can to deal with the sequelae of their cancer diagnosis and treatment. Our navigators, as I said before, have really helped us broaden our program to multiple other disease states, and they are integral to us getting our treatment summaries and survivorship care plans completed. And our care plans are built into our EPIC EHR, and that really does help us to complete these. We do have different sites that do not currently have EPIC yet, so that is one of the challenges. And we do have a multidisciplinary team that works very well together, as well as our physician champions that have helped us along the way and provided support for these visits. And we do also have the community partnerships with Livestrong, Us Too, Look Good, Feel Better, the Pink Paddling Power teams, and we get support from our foundation to provide programs in relation to our survivorship visits and our oncology patients. Next slide. So some of the opportunities or challenges that we face are that we are a large organization with multiple areas throughout the state since we have merged with Ascension, and different hospital systems have different EHR. So we are working on eventually all getting onto EPIC. So that will really help integrate our assessments and our care plans. We also wanted to maybe formalize some survivorship assessments, looking at NCCN guidelines, as a basis, and integrate those into the electronic health record. And then look at some patient engagement tools such as apps and things like that to help patients make those behavioral changes, or health coaching, maybe expanding this into more of a health coaching kind of visit as it moves forward. And then there is, we do notice that there is a gap everywhere in behavioral health resources and access. So that is something that we would like to look at and figure out how to improve. And always primary care, we do send our plans to our primary care providers, but we would like to collaborate a little bit more with them and integrate them into the process. And lastly, just really wanting to know what patients want. And as we've done several surveys, it's kind of all across the board. So we also want to make sure everybody has access to these services that would want to, because currently we're doing it, we're completing these visits with patients that are curative intent only. So that is pretty much it for us. Our contact information is there if you have any questions. Thank you.
Thank you so much. And then we're going to switch to Kathy Myers from Freighter and MCW Cancer Network. And Kathy, just 1 second, we're working on unmuting you. You should be unmuted now. Are you able to talk?
Can you hear me?
Yes, thank you.
Can you hear me?
Yes.
Oh, great. Okay. Hi. Thanks for letting me participate, Alexandria. You were super supportive to get me here today, so I appreciate it. Just a little bit about our location. We have a big footprint in southeastern Wisconsin, mostly the Milwaukee and the greater Milwaukee area. All three of our hospitals are COC and NAPBC facilities. And you can go to the next slide. Just a quick overview of our program. We meet the needs of our cancer survivors by providing the survivorship care plans that many of you do. We do have 13 disease-specific care plans that are within the electronic medical record EPIC. We have consistently met the COC and NAPB standards, delivering about 1,000 survivorship care plans a year. We do have a collaborative workflow to ensure our patients have a personal SCP. It is clinic-based, and it is with their RN that they are used to working with that end up delivering it after an MD or APP review. And then I think another unique thing about our cancer center is that we do have a quality of life center within the walls of our building that houses our psych-onc, dietitians, social workers, financial counselors and navigators, chaplains, genetic counselors, and our cancer rehab PT/OT is also in the building. We have another Small Stones Wellness Center located very close to the Quality of Life Center that helps patients with wigs, scarves, skincare classes. And it's kind of our hub for integrative complementary services. It's had to be modified a little and suspended at times during COVID, but we consistently have offered acupuncture, Reiki, aromatherapy, and other complementary treatments like that. We have support groups and classes available, and we do have a clinical RN coordinator that monitors it all, not necessarily delivering the care plans, but helping build the processes that allow that to happen. Next slide. I think our strength is that we were able, as many of you, to provide the survivorship care plan integrated in the EPIC chart. We also had an opportunity working with an EPIC consultant to develop tools that were customly made that we could use a system in the chart or in the EPIC record that we could track, case find, and just make sure that we are delivering the survivorship care plans in a timely manner and not missing anyone. We have 2 dedicated survivorship data coordinators who are non-nurses who monitor this. do some chart abstract to make sure some of the items that are easily abstracted from the chart already in the survivorship care plan, decreasing the load on the clinicians at the front line while they review it. A lot of the care plan is completed. So it's kind of a team that works, some more behind the scenes and some patient facing, but the RN clinical coordinator, the clinic managers and RNs, oncology APPs and physicians and senior leadership in EPIC, we have a lot of support for our programs. So I think those are our strengths. And the next slide. I think our opportunities, while we do use a lot of the quality of life services, our patients can walk up and get them. They're pretty accessible. There are referrals that are outside of our building that I think we have an opportunity to use more. Our fertility care is off-site. Our oncocardiology is off-site. So I think that is going to be some of our goals next year, to try to make sure things that are not readily available geographically are something that gets more routinely involved with our patients. Another area is we do have staff turnover, and I feel like one of our goals this year is to make sure we're continually offering RN staff education to maintain the quality of the survivorship care plans given to the disease-specific groups, that they know what are we supposed to be emphasizing and discussing with our patients at every level and every disease type. And the next slide. This is my contact information. So that's all I have.
Thank you so much for presenting today.
Thanks, Alexandria.
And then next we have, I believe it's Lisa Johnson-Blesky, the oncology nurse manager at the Cancer Center, Western Wisconsin, the Westfield location. Are you there? Lisa, I believe you might have called in on a phone number. If you could let us know the phone number so we can unmute you.
Hello, this is Lisa. Can you hear me?
Yes, wonderful. Thank you.
Awesome. Thank you for that introduction. As she said, I'm Lisa Johnson-Blesky. I'm with the Cancer Center, Western Wisconsin. We have 6 locations, and the one I'm talking about today is our new Richmond location, and that is right on the border of Minnesota. So our nurse navigator, Andrea Larson, who's put these slides together today, is unable to join us. So bear with me as I go through this. We have not had a formal survivorship program prior to 2020. In 2019, we pulled together a project improvement team, and that is shown on this slide. So that consisted of our director, myself, our social worker, and then our nurse navigator. And then the next slide, please. Andrea just wanted to talk quickly about the process that we put into place. Basically, we had all of our stakeholders, our oncologist, our nurse practitioner, social worker. We involved patients, caregivers, primary clinic, nursing staff, all on a project improvement meeting that was 4 hours, and did a lot of work in designing what survivorship should look like at our site. So Alexandria, I'm actually going to have you skip to slide 9, if you could, please. Thank you. So while she's getting to slide 9, I want to talk about where we're at today. We formally started our survivorship program in 2020 and decided that we're just going to focus on breast cancer patients to start with. And then at the end of 2020, we wanted to assess how that was going and see if we can broaden that to other. Perfect. That's good. Thank you. So how our program is set up right now, our nurse navigator tracks all of our breast cancer patients as she's getting their new consult set up. She's doing a manual Excel sheet right now, and she tracks when they see the doctor, when they start treatment, when about they're going to end treatment, and then she sends a message to the provider when they should be set up with their survivorship visit. And then our provider does like a warm handoff with the patients. Typically, we have patients set up 4 to 6 weeks after they're finished with their first line treatment with our nurse practitioner, and she goes over a care plan, and it's the same as several of you have mentioned in Epic. And then she does like initial visit with the patients and then sets up follow-ups as needed. And that has been going really well. We do also offer dietitian services, and we have a supportive counselor. So what's been going really well is that we have been able to integrate them in the program. And we've had 32 new breast diagnoses so far this year, and 100% of them have had their care plans. And now you can go on next slide. All right. So we've noticed some gaps so far. Some patients that are on, the patients that are receiving like the yearly Herceptin, we're trying to figure out where is the best time for them to get their survivorship visit. We try to do it after their AC. However, some of those patients need to get hooked with resources and just our nurse practitioner sooner than they finish that, just because of all the psychosocial issues that they're going through. So we're just trying to figure out when's that best time, and then just getting patients the resources that they need, because it's great to have a survivorship visit set up at the end of their treatment. However, there's some gaps to them getting some of the services that they need sooner. So next slide. All right, and then just Andrew included some goals that we're working towards, and that is doing the audit, and then just identifying where we need to go from here, and hopefully we can expand to other cancer diagnoses. And then I do not have our contact information in here, but I will include it in the chat. Thank you so much.
Thank you so much. And thank you for just hopping in last minute with providing a presentation. So I appreciate it. And of course, yeah, any contact information people want to provide, feel free to add to the chat. And I can compile some of this information to send out to you all when we're done. And then Jenny, I'm just checking back to see, I'm still not able to unmute you. So I'm wondering if you are around. I don't want to speak for you.
Yes, I'm here.
Awesome. Okay, let me just go back to your slides. Apologies, 1 second. And I hope this doesn't make anybody nauseous.
Yeah. It's hard to say with kids.
Okay. And I think somebody needs to mute, please. Sorry, Jenny, just trying to find where the presentation is quickly.
No worries. I think
there we go.
Yep.
Yep.
Okay. So my name is Jenny Minasali. I'm one of the nurse practitioners at the UW Cancer Center and run our survivorship program. If you want to go to the next slide. So we started our program about 12 years ago, just delivering survivorship care plans. And then 8 years ago, we formed, we had a grant in which we were able to do a formal survivorship position with an NP, but found that it was not a good use of resources. And frankly, that patients were very reluctant to come in for dedicated survivorship visits and just normal. And so then after trying to get it really up and running for 2 years, we then just decided to disband the dedicated survivorship NP position and distribute the responsibilities amongst all the NPs in our group. So since that time, we as an entire NP group do survivorship visits. We create and deliver the survivorship care plans. And that for the most part is how we've been delivering survivorship services. We also have a survivorship program that is a monthly program that we offer twice yearly. So it's run once a month for 6 months with a cohort of about 10 to 20. And each month there's a different topic that's delivered. And we also have a very robust PTOT program offering yoga boot camp in addition to the traditional lymphedema rehab sort of services offered. Next slide. I think some of the strengths of our program is that we have a very well-oiled machine for creating and delivering of survivorship care plans that really involves all the different disciplines. And we have a pretty high completion rate for the delivery of our survivorship care plans. Like I said, we have really great dedicated PTOT providers that offer a lot of different services for our survivors. And we also have 2 really wonderful counselors that have in the past year focused on addressing PTSD for our survivors and provide one-on-one counseling in addition to support groups. Next slide. One area that we want to improve upon is expanding the disease types that receive survivorship care plans. And as everyone else, just making the process simpler, more efficient, all of that. And then again, hoping to increase enrollment in our survivorship program. Our program was on suspension for the second half of the year due to COVID, and we're going to do it virtually starting in January. And we're excited to see if that really improves actual enrollment, because our springtime one always was a bit of a challenge. People were reluctant to attend it due to poor weather, driving at night in the winter, things like that. So we're hoping that maybe by doing it virtually, we'll get better participation. Next slide. And this is just what leads our counseling and the survivorship educational program and is a great resource. Any questions?
Thank you so much, Jenny. I'm glad we were able to get you on. So apologies about the technical difficulties.
Thank you. Sorry about that I had to step away.
Oh, no worries. Okay. And so thank you. So I'm going to go to the end now and we're going to open up to questions. And sorry again if this makes you nauseous. So I just want to thank you all again just for doing these quick flash talks. I know it feels a little weird, but it was our attempt to kind of incorporate some of the networking aspects that we don't have because we're not in person. And also just hopefully more people were able to attend this meeting virtually. So some pros and cons to the situation. And so I am open to questions, comments. This can be about the survey. It can be about maybe a question about a specific program or a project somebody's working on. And I do have a few questions for the group as well. And feel free to do chat or unmute yourself. Just try to mute yourself when you're done talking just to minimize any feedback. And I guess while everybody's thinking, one question I do have is if anybody in the group has been having some experiences with the virtual exercise programs or what the Live Strong programs have been doing in your community. So I'm well aware of the Live Strong program, but I am not quite sure what has been going on in the time of COVID. So any feedback is welcome for that. And then Deanna just added in the chat, I think a roundtable to share resources would be great in the future. And I absolutely agree with you. And again, we've been creating that resource sheet for providers offering survivorship care. So if there's anything specific to your system or another organization that you think is helpful, please feel free to send to me so we can update that. It's sometimes good to just have things in one spot. And can anyone share about the exercise programs if they know of anything?
So this is Kirsten calling from Gilda's Club.
Thank you.
And, and I don't know anything specific about other programs, but we have been doing all of our yoga classes and Tai Chi classes virtually since March, and providing all of our support groups virtually as well. So it's been a really interesting experience, and lately we've actually had a lot uptick of some participants in different parts of the state. So I think that it's really great. I mean, for us, it's a great opportunity because people who don't have support groups in their area now can access us for anybody in the state of Wisconsin. So kind of great.
Yeah, thank you for bringing that up. And I've been hearing that you have been doing really well and the virtual programs have been well received. So thank you. That's a great update. And definitely a positive despite everything that's been going on. So thank you. And then I saw that Deanna added in the chat, I heard like Live Strong is up and running. So that's good to know. And that's probably dependent on some areas of the state, I would imagine. And then Sherry presented a question to the group. So again, feel free to jump in either on chat or and so she asked, is anyone measuring patient-reported outcomes related to survivorship? And I'm not sure of the answer to that. So if anybody in the group wants to chime in. And I'm sorry, I know it feels a little awkward when we can't see each other and kind of read who's going to talk or what's going on. So I apologize about the awkwardness. Okay, and so Dr. LeConte shared that we're doing some PROs and a survey for cancer care with COVID. There may be others. So Sibeli, you can feel free to chime in if there's anything you want to add. And then something that people asked previously was the availability of translated survivorship educational materials. And I'm wondering what everybody's doing with that and if that's something that they've had available or not, particularly in Spanish or Hmong.
This is Jamie Cairo. We do have a Spanish-speaking nurse practitioner in one of our areas, and she has a subspecialty Spanish clinic for our survivors, and has also worked to help us do some of those visits remotely with some of our other locations. So that's worked out quite well, but I do think that that's an area of need.
Thank you so much, Jamie, and that's good to know. Thank you for sharing that. And then I see Taylor said in the chat, we had a trial in 2016 that looked at practical concerns and late-term effects in patients who had a survivorship appointment and who didn't, so mainly breast cancer patients. And it was in GOP. If anybody wants a link, please contact them. So thank you, Taylor, for adding that. And then I guess, did anybody have any thoughts about the survey results and what we're seeing, or is it kind of in line with what you were expecting?
Alexandria, this is Noelle Conti. It seemed to me a lot of the areas for improvement followed with insurance coverage, like fertility services and counseling.
Absolutely.
And exercise therapy. And I just wonder if there's a way we could advocate for better coverage or some other solution there. I think there's a large demand. People are probably not referring for it because the patients can't afford it.
Yes, thank you for bringing that up. And I know that's a conversation I've been having with you and others, so thank you. And so part of the results of the survey, and just from these conversations too, is we're trying to synthesize these themes so we can refer to our Cancer Collaborative Policy Committee. And I can't guarantee anything will happen with that, but it's good for us to be aware of and to work towards progress. So especially for things that are not being covered that are a service. So is there anything you want to add to that? Or Sarah, if you want to add anything to that, more about that process.
Hi there, about the community of practice or the quality improvement work?
With about the fertility services and support services that might not be covered for insurance.
Yeah, absolutely. It seems like that is certainly a gap in terms of insurance coverage and the ability to access those services, albeit very important to quality of life. And it seems to, differ across state lines, which I'm sure for any of the participating health systems that cover multiple states, it's probably fairly complicated. So we do have a policy committee that is actively working on selecting new policy agenda items. So if that you would suggest be something that that is perhaps too difficult for an individual health system to educate and take up upon themselves, it's certainly something that we could consider including in the policy agenda for the Wisconsin Cancer Collaborative. So if you have any input on that or any other, insurance or restriction in services that are not provided due to insurance coverage or the lack thereof, that could certainly be shared out to us so we could aggregate that and share with our policy committee.
Yeah, thank you so much, Sarah, for explaining that a little bit more. And yeah, and you feel free to provide feedback about that either now, or you can also feel free to always email me, and I'm happy to collect that information. So. But it is, oh, yep.
Well, I can speak to the NCCN piece, and I apologize. My daughter is practicing her tuba during this call.
No, that's okay. That's
sorry
perfect.
if there's a musical interlude here. We did at UW suggest to NCCN at least some language that would help perhaps with, peer-to-peer requests around these kind of services. But of course, us suggesting it doesn't mean they'll put it in the guidelines, but we are trying to push the system a little bit.
Yeah, and thank you for adding that. It's good to hear about any time that we're attempting to move the target with us, so thank you. Does anybody else have anything to add about that topic? The musical interval might have helped right now for filling the silence, so.
Alexandria, it does seem as though a few participants have shared various resources or published articles that they have written and been published themselves. So I think if if it would be possible, it would be great to perhaps have an opportunity to share and disseminate links, or at least to the abstracts to those. It seems, you know, it's specific information to Wisconsin as well. It would be really helpful for others within this group to learn more about. So that could be a possibility to share back out.
Yes, I completely agree. And anything that you all want to share with us, we really appreciate. These articles are great, especially as we're trying to do this benchmark of Wisconsin survivorship practices and then where we're going from here. And so any of the specific data or things that have worked here would be very helpful, I think, to the group. So thank you for that thought, Sarah. And I can work on compiling a list of anything that you all provide to me. And then does anybody have any specific questions for any of the health systems or people who presented today? I know I didn't have time for questions after that, so I apologize, but I just wanted to make sure we got through everybody. And I recognize we're all I was really impressed hearing about so many of the similarities and differences between all of our programs and how we approach services. So thank you all for that. Okay. Well, I guess, does anybody have any other final questions, comments, anything they want to talk through? This would be a great opportunity for that. Anything survivorship related?
Alexandria, this is Sarah. I was wondering if this might be an opportunity for participants to perhaps give any feedback about that tentative timeline that you presented earlier on. We recognize that there are significant challenges, and when we initially established that tentative timeline, you know, things have changed. And so we would be really interested in finding out, you know, what might be feasible on your side to allow you to participate in any type of quality improvement efforts based on the surveys that you all completed. So if anyone has any thoughts as Alexandria goes through the slides to get back to that. Here we go.
Yeah, you should be able to see the slide now. Apologies, there's a bit of a delay when I get the slides onto the presentation. And so, yeah, this was our tentative timeline. So hoping to invite you in November, December, confirming interest and willingness to participate. And then understanding with holidays and everything going on that probably January would be when we would begin to check in with sites to develop and finalize what you want to address. This could be in line with something you already want to address or are already working on. And then submitting work plans February 1st. And then our hope would be about June, having individual meetings with cohort sites so we can provide technical assistance, check in on seeing what is going on and if things have been going well or improving or any struggles you're having. I'm anticipating these will be via Zoom and not in person. And then next December, which is, I know, really hard to think about right now, reviewing and assessing work plan progress further. And so I'd appreciate any feedback from anybody about this.
I think I'm hopeful that timeline will work, but it all depends on COVID.
Yes, absolutely. Yeah, the magic words right now, but yeah, thank you. Anybody else?
I have a follow-up question. This is Sarah. Are there any resources that might be useful to everyone participating in this timeline that would maybe make it a little easier to participate? Anything that we can do would be interesting. We had discussed developing work plan templates to help guide the work. Of course, Alexandria is, as you've all experienced as well, really diligent about following up and checking in if you need anything. So she'll be readily available as well. to assist as well. But if there's anything else in addition to that, we would be really interested in hearing how we can best serve your needs so you can best serve your patients' needs.
Yeah, thank you, Sarah. And I'm just checking the chat now. So just referring to previous questions. So Sibeli from Carbone said we have a study about patients' acceptance of referrals for concerns during the transition visits after completing breast cancer treatment. And then she's going to check on other studies and turn back to the group. So thank you very much for that. And then Dr. Laconte brought up, I recently worked on a statement about skin cancer prevention, which includes a role for oncology providers to talk to cancer survivors about skin cancer prevention. So thank you for providing that. So it definitely sounds like everybody is happy to provide some of these resources, and please feel free to do that in the coming weeks so I can compile that and share that with the group. So thank you all for that. And it's exciting to hear about the different studies that are going on at your locations.
Alexandria, since we're unable to do a show of hands, I was wondering if it would perhaps be possible to just have a yes or no. We wouldn't hold this. This is not a binding MOU or anything of that, but to see individuals' willingness to perhaps participate in kind of the second phase of this work. Yes, it seems of interest, maybe need more information or approval, or no, it's just not feasible right now. If anyone would be willing to answer that in the chat just quickly. Again, this is not something that this is not legally binding, I promise.
Thank you. Yeah, that would be great to hear from everybody. So thank you for that. I'm seeing some yeses, so that's good. So I'm glad to see that. And again, as we're thinking through this, flexibility is going to be key. And I'm really willing to work with you on whatever needs that you need to be addressed. I'm happy to sit in with meetings just to kind of coordinate or bounce ideas off of. I'm loving hearing about all of your survivorship work and the great work that you're doing. And I want to give a shout out. I don't remember which system it was, but I saw about about screenings and cancer prevention and vaccines. So I was excited to hear about that as I work with that as well. And yes, of course, depends on time commitment and administration, okay, especially as we're just dealing with COVID needs. So thank you all.
And it looks like we had a hand raised by Kathy. So I was working to unmute Kathy's phone number. Kathy, can you hear me and unmute? Or maybe the hand raise via Zoom was an accident. Oh, okay, never mind.
Nope, that's okay. Okay. Well, thank you, everybody. And is there anything, open forum, anybody wants to address regarding survivorship or what a survey site was doing?
Alexandria, this is Noelle. I think one area of interest for me would be exploring rides and transport and how people have been tackling that problem. And I think also a statewide sort of universal, kind of what is our expectation that every survivorship program ought to have.
Yeah. Okay.
There's some variation amongst the programs, but I think we could sort of establish like every program, has XYZ.
Yeah. Okay. Yep. Thank you. And does anybody want to speak to the rides or transport? That's actually something that didn't come up in the survey. And so I'd be interested to hearing how any organizations or locations are dealing with that. Dr. Laconte, do you know what they've been doing at Carbone?
Our social workers can get things like cabs, and then we work with philanthropic dollars to build out a rides program. But I think it's very much like spot welding, kind of figuring out as you go along.
Is that only available to like patients in the local area or out of county?
I think it's case by case at this point.
Okay, thank you. Sorry to put you on the spot,
No,
but
that's okay. That's okay, but I think it's pretty clear that transportation can be a real issue, and I'm just worried about patients as they start getting laid off or losing their jobs or getting pay cuts, that, you know, things like survivorship care may be not feasible.
yeah, absolutely. Thank you for bringing that up. And I see Lisa just added to the chat. We have 2 vans purchased through grant money that we use for our cancer center, and the van drivers are employed through our hospital. So that's good to know. And what are they doing during COVID? Lisa, is there anything you can add about that? Or anybody else speak to this?
This is Jamie Cairo again. So I think this is always an issue, you know, not just for our cancer survivors, but for all of our patients, and it's certainly become more of an issue during COVID. I think one of the things that we've discovered is, you know, a new embracing of virtual visits. I've done a number of phone call visits with cancer survivors. And it's not ideal. It's not what I would prefer to do, but it does work, and it's very convenient for some people. We've done some video visits as well, and it's something that I feel like in oncology we've been a little bit reluctant to do, but we're having to try it out, and so it at least keeps people connected to the process. We can at least kind of keep moving through survivorship, and not let people fall behind on those things. So virtual visits has been helpful.
Okay, that's good to hear. And thank you, Jamie. And what sort of things have been helpful as you all have been doing the virtual visits? Is there any standard practices, or has it been successful more with certain patients?
Alexandria, we've been relying on this concept called webside manner instead of bedside manner. Which includes things like where to position your webcam relative to your forehead and your eyes, the lighting in your room, the need for privacy for providers if they're calling from their home, but also how to communicate that you're listening without saying things like, yep, because that over these web platforms will cause this weird like break in the conversation. But I completely agree with the prior speaker that it's not the way I think any of us trained in oncology would prefer to communicate with our patients. And for those of us that provide care to the Department of Corrections patients, the web platform is very, very clunky through the Department of Corrections. It's a Band-Aid, you know, it's not the best way to do it, but it's better than nothing.
Yeah, thank you for that. And I had to refrain from doing my uh-huhs and agreeing with you just there, trying to minimize feedback. So I recognize that as well. So thank you for bringing that up. And I see Kathy added from Freighter, transportation is always hard. Our social workers work hard to use various resources. It's easier for seniors than adolescent and young adult patients, I believe you're saying. And then the virtual visits have been helpful. Okay. And then Deanna, I agree. Prefer in person, but video or phone is acceptable. And we mail the materials and do a follow-up call after they receive the plan in the mail. So yeah, that's a great idea. Thank you for bringing that up. Oh, yep. Thank you, Kathy. There are more transportation resources for seniors, few for the adolescent young adult. So thank you very much.
This is Erin Costanzo from the UW Cancer Center. I'm a clinical psychologist, and I just wanted to say, we've actually been finding some benefits to telemedicine, especially with our patients coming from rural areas or people who really aren't feeling well to come see us in clinic. We've probably been busier than usual in terms of providing psychology services with telemedicine. So, I think we're actually hoping it will be something that we can continue to do for some portion of our patients.
Yeah, thank you, Dr. Costanzo, for adding that. And I just anecdotally have been hearing from members in my life, especially in rural areas, there's still a stigma with mental health. And so you're not parked at the clinic for psychology services. And so that's sometimes a concern patients have. And so that's been an interesting and good thing about the telehealth services. So. And Dr. Costanzo, I see your hand is raised. I'm not sure if that was from before or not.
Yeah, that was just to
okay.
offer that insight. And I do agree with Noelle that there are some limitations, and we've had to adjust to having therapeutic conversations via video or telephone. But it has actually, I think, been a really good thing for a lot of our patients who haven't been able to as easily access those services that we might normally see when they're coming to clinic, for a follow-up visit with their other providers very irregularly, but now we're able to provide better continuity of care.
Thank you so much for that input. And then I see Lisa added to the chat, we are offering chemo education virtually. However, getting printed resources to patients can be difficult in a timely manner if patients don't have printers at home. And yeah, absolutely. Anything else anybody wants to add? I also recognize it takes a little bit of time to just digest everything that we just heard and the data. And so I'm always happy to answer any questions via email. If you ever want to meet one-on-one via Zoom or something, I'm happy to do that as well. And we will have all the contact information for the site. So hopefully if there's things that piqued your interest, you're able to reach out to one another. And just, it's nice to know other people who are working on survivorship in our state. Okay. Last call. Okay. So I'm going to work on, in the coming month or so, we're going to work on some invitations for participating in this community of practice. And then I'm going to give you time to just digest everything that we have gone through today. I'm going to work on compiling some of these resources that you have all contributed to the chat. And please feel free again to email anything, or if there's anything that is you want to share with us, success stories, even problem stories, anything that you think would be helpful to the group. Also, if there's something you want to share more widely to our Cancer Collaborative membership, I'm always happy to do that. Just specify that. We won't share that information without your permission, of course. And then I just really appreciate all your time. I know a lot of you have just been really balancing a lot of priorities, and you still made a point to participate in this survey. You still made a point to, even when being pulled into clinic, to be a part of this. And I just think that speaks volumes of all of you, and just makes me really thankful for our state and the cancer survivorship work that is occurring. So thank you so much to all of you, and thank you for everything that you do. And then Sarah, do you want to add anything or final thoughts to the group?
Thanks, Alexandria. Well, I would like to thank you, Alexandria, for all of your phenomenal work putting this together. I'm sure that everyone here in participation is incredibly grateful for your flexibility as well. And I would like to also, though, echo Alexandria's thoughts about your commitment to cancer survivors in Wisconsin is clearly apparent, being pulled away in so many different directions. I did want to let you know that we will be hosting our Wisconsin Cancer Summit next week, October 28th and 29th. Alexandra is probably going to skip through a few slides here too, to make sure that you all have the information, but that is a free virtual summit. It's typically in person. We'll so miss you in person, but are really thrilled about the opportunity to meet with you in person. And we're thrilled, or virtually, excuse me. We're really thrilled to have Dr. Lisa Richardson, who is the Director of Cancer Prevention and Control at CDC, join us and talk about how leading with change and reducing cancer throughout the nation, and of course in Wisconsin. And you're all doing the wonderful work. So hopefully we'll see your name virtually next week. And thank you again to all of you. And thank you so much, Alexandria.
No problem. I'm happy to support you all in whatever you need. So any feedback, anything you want to bring up, thoughts, concerns, questions, please feel free to email me. I am realizing I did not include my email, so I apologize. So I'm just going to add that to the chat. And of course, happy to meet about anything and share anything that you all want to be shared. So thank you so much. And then we'll just finish a few minutes early if that's okay with everyone, better than later. And just good luck, everybody, as you're continuing your great work that you're doing. And I really appreciate everything that you're all doing. So thank you.
Thank you.
Thank you. Bye.
Thank you, everyone. Have a great day.